Well, on Wednesdays here on 12 News Now at 4, we are joined by Rhode Island Department of Health Medical Director Dr. Jim McDonald. Doctor, thanks again for being with us.
Thank you. It's always fun to hang out with you on these Wednesday afternoons. I appreciate it.
We appreciate you being here. Earlier today at the governor's press briefing, she said folks should tune in again on Friday because she's going to announce some new restrictions. She didn't say exactly what those restrictions would be, and it sounds like she might not know exactly what they're going to be. I know you and Dr. Nicole Alexander Scott are close advisors to the governor about the impacts that this virus is having on the state. So what do you think the restrictions should be that she implements on Friday?
So the way I would think about this is, where are we seeing high risk pain points for us in the state with our pandemic right now? And it's when we're indoors, and it's when we have informal gatherings, and it's when we have inconsistent groups. And the governor mentioned those three I's today. So, I don't think she's decided yet, and that's why I don't know exactly what they are. But these are things that I have to think about. Like, we really value our economy. We really need the businesses to keep running. That's really important to us. All of us, by the way, get it. I think one of the most powerful public health interventions we have is a job with health insurance. So it's really important. So we're trying to balance having an economy, but also we have this pandemic occurring. And so it's really quite a balance. So I think it's going to be looking at things that help to reduce us from spontaneously gathering and moving too much.
Do you think it would be beneficial for her to lower the social gathering limit from its current maximum of 15?
I think it's something that has to be strongly considered. And I know that sounds like the state's trying to control too much here. But I think it's important to think about this. Like, there was a comment made nationally by somebody saying, we can't control the pandemic. And I just think that's just wrong.
You also mentioned controlling how much folks move around and interact with various groups. Do you think we're heading back to another stay-at-home order?
I don't see that coming at all. I really don't. I think we all know that that's a problem too. I mean, I think when we think about the shelter-in-place order, we weren't wearing masks back then. We weren't really 6 feet apart. We weren't having hand sanitizer everywhere and anywhere. There were shortages there. Nobody wants to go back to a stay-at-home order. Didn't we all feel like we were grounded but didn't do anything wrong? It was uncomfortable for everybody. By the way, we know the isolation hurts people. We know the isolation affects the overdose epidemic. It affects people who have mental health illness. It affects the kids. It affects all of us. So we have to find a way to balance this. But I don't think we're going to see a shelter-in-place order at all.
That is really good news. Last week, you and I talked about the COVID death rate. It's dropped from, I believe you said, around 10% in the spring at the height of things, now to under 2% as we are testing more and uncovering more cases in young adults who do better with the virus. Can you just put that 2% death rate into context for us, though? How bad or good is that? And maybe you could compare it to something like the seasonal flu.
Yeah, it's the right question, Kim. If you compare this to the flu has a death rate of about 0.1%. So it's about 20 times as much. And we don't accept that, right? And of course, we know with COVID, there's higher risk individuals, but let me help you understand who's high risk, because can I help you understand this? It's most of us. Yeah, it's definitely the people who are older than 65, but those of us who are obese, and that's a lot of us in America, it's about 2 out of 3 adults are overweight or obese, just being honest with you, my friends. And then those with high blood pressure, and in America, about 45% of Americans, that's 45% of Americans have high blood pressure. And those with diabetes, that's a bunch of us too. And what I'm saying is, either you're a high-risk person, or you live with a high-risk person, or you're friends with a high-risk person, or you have no friends. I mean, I gotta be honest with you, my friends, this is the way it is. There's just that many people out there. And that's why I think all of us need to take this seriously, because even if you're young, thin, and healthy, good for you, by the way, but having said that, people you know are at risk, and that's why we have to be very careful and very diligent.